coming up. But first, here with us now, Democratic representative from Maryland and member of the Joint Economic Committee and the House Task Force on Health Care Reform, Congressman Elijah Cummings. Congressman, thank you so much for being with us this morning.
It's good to be with you.
All right. I'm sure you remember the reaction that Senator Grassley got when he made that comment in a crowd about pulling the plug on Grandma. I think we played it again and again and again. So I wonder if you think this is the other side of that. This is Representative Alan Grayson of Florida. I want to play this for you and get your response. Speaking, I believe, on the House floor yesterday with signs. Take a look.
The Republican health care plan is this. Die quickly. That's right. The Republicans want you to die quickly if you get sick. Do you want the Democratic plan or do you want the Republican plan? Remember, the Republican plan, don't get sick. And if you do get sick, die quickly.
Congressman Cummings, are you prepared to say that he went too far? Representative Grayson went too far in his language.
I'm not prepared to say that because I see not so much to die quickly, but I see a lot of people in my community dying slowly because they don't have health care and don't have insurance. And many of them have been the victims of the ones who did have insurance of rescission
Wait a minute.
Yes.
Congressman, Pat Buchanan wants in, but let me just have at it a little bit here. You really think that language and that sign was appropriate in this conversation?
No, I didn't say that. I said that I'm not prepared to address that because Grayson has his opinion, but I can tell you what I see in my community every day. I think that's more significant with regard to what I have to deal with and why I'm so anxious to see a public option come forth. But as far as Mr. Grayson is concerned, he has an answer for himself. But I can tell you that in my district, when I go to town hall meetings and I ask, say, a 90% African-American audience how many know of people who have died within the last year that they knew or believed strongly should not have died because they didn't have insurance or were not treated properly, 90% of the people consistently hold up their hands.
Okay, Pat Buchanan. Pat Buchanan has a question.
There appears to be something of a double standard here. When Joe Wilson said "you lie" and made that outburst, that insulting comment to the president, he called the White House, he apologized, and he apologized on the floor, or he apologized for what he had said, yet the Black Caucus drove him to the wall and demanded a floor vote and rebuked him. And for saying that, which was a spontaneous outburst, stupid as it was, and this fella can get up there with a premeditated statement and say the Republican Party, their whole policy is to hope you all die quickly and repeat it and repeat it.
Well,
it's not worthy of condemnation.
Again, I'm just hearing this, and again, I'm saying to you, that's up to Mr. Grayson. He should address it. As I said before, I want to be sure that we stay focused on getting health care for all Americans, and those things. If he wants to apologize, he can do that. But I've got to stay focused because I've got people in my district who are suffering and who are dying. And so when you got, according to the Institute of Medicine report, 18,000 Americans plus dying every year because of either no health insurance or being underinsured, I don't want to get through the distraction. I don't want to deal with that. I want to deal with getting health care done.
All right.
That's what's most important.
I don't disagree with that. Mike Barnacle, Willie Geist have questions for you too. But I will say, just first of all, when Republicans have been called out, Grassley or Wilson, on saying inappropriate things or taking the conversation in the wrong direction, even members of their own party said, come on, guy, back off, come on, let's get the conversation. We need to keep it real on both sides.
And part of keeping it real is for Mr. Grayson, if he's going to apologize, go ahead and apologize. When it came to Joe Wilson, I said that I've been dealing with racism for all my 59 years. But that does not get one more person in the state of South Carolina where Joe Wilson is from. This is what I said. One piece of insurance company, 19% are uninsured down there, where my mother and father were sharecroppers. So what I'm trying to say to you is we've got to stay focused. 83% of African Americans, for example, have jobs, but only 50% of them have health insurance from employers. And so and it goes the same for minorities. Half of the people who are uninsured are minorities.
Okay.
And they're only 1/3 of the population.
Mike Barnicle.
Congressman, let's focus on the public option that went down yesterday in the Senate before the Senate Finance Committee.
Yes.
Let's explain it for people, if you could, because I can't explain it. Under the public option plan as proposed, would everyone have the right to apply for the public option insurance, or would it be a cutoff in terms of your income or whatever? Can you explain that to us?
People would have the right to go in. They could go into the exchange. The public option would be one option within the exchange. The public option would be cheaper because they won't have to deal with marketing. They won't have to deal with trying to make sure that their stockholders get money, and it'll be a cheaper plan. And so they'll have an opportunity to at least get insurance. If you remember when the president spoke before the Congress, he said that I want to have some kind of plan whereby if people cannot get insurance, they'll have an option to get it, and that's what it's all about. So, and that, by the way, that's the only way that I see that we're going to be able to drive down the cost of insurance. You can have insurance, but if you can't afford it, what difference does it make?
And it sounds like yesterday from the vote we saw in the Senate that at least on the Senate side, the public option is dead, Congressman.
I would not say it's dead, but one thing I must say is that if the public, has said to me everywhere I go, shopping centers, gasoline places, telling me that they want the public option, the public needs to get on the phone and begin to talk to their senators and talk to those people who may be opposed to it.
Yep.
But we will get a robust public option out of the House, and this is not over. It is not over, and so just hold your powder, keep your powder dry.
All right.
We still have a ways to go.
All right. Well, there is pressure on Democrats to keep that alive, including from Michael Moore. He's got a new documentary out.
Yeah, I went to see it last night. It was very good.
Did you see it?
In it.
Okay, good. So Michael Moore, he was out, not in the film, but he's out promoting the film, was at an event last night, talking about the pressure he's going to keep on Democrats to get real health care. I want you to listen to what he said.
To the Democrats in Congress who don't quite get it, I want to offer a personal pledge. I, and a lot of other people, have every intention of removing you from Congress in the next election if you stand in the way of health care legislation that the people want. That is not a hollow or idle threat. We will come to your districts and we will work against you. You don't think so? You think that we're just going to go along with you because you're Democrats? You should think again.
Sounds like a threat, Congressman.
Oh, my goodness.
It sounds like a very strong threat, but I think where Michael Moore is coming from, if you saw Sitco, you would understand why he's saying what he's saying. There are a lot of people who are suffering out there. You may not hear their stories on MSNBC, but I'm telling you, there are a lot of people who are suffering and who are dying. And so I think what he says is that, this is our watch. We must do something not only for today, but for generations yet unborn and make things better. And I think that's what Michael Moore is basically saying. This is the moment. It's not going to probably come again during my lifetime.
Hey, Congressman, we only have a couple of seconds here. Can you back to the definition of public option? Can you clear this up for me? If I'm a 32-year-old hedge fund manager on Wall Street making $500,000 a year, I have no family, no kids, I'm in good health, I can get into the public option plan the same as someone making $25,000 a year with 3 kids?
You're going to keep in mind in the public option, you still have the private insurance companies. They will still be in there, and you'll have the public option. And so, in the exchange, you'll have it so that you probably could.
All right, Pat. I thought
it's for getting quality and insurance.
Congressman, if the public option's that important, why didn't the president fight a lot harder for it? Did you hear about him calling the Senate Finance Committee? Those things went down 15-8 and 13-10.
I think the president knows that things are going to be difficult. He said this wouldn't be easy. But I haven't given up on the president. The president, as I've said on this show many times, when you thought he was down and out, suddenly he rose up. And so I still expect to see the president come out for this, and I have no reason to believe he won't.
Okay, Congressman, thank you very much for taking all our questions this morning. Come back soon.
My pleasure.
Coming up, which country will take the strongest step